Don Fitzgerald loves to golf with his family. Recently, while playing with his wife,
we're walking, and I went, ah, and she goes, "What's the matter?" And I said, "No, this is the first time I've walked this hill without being out of breath."
It's a new feeling for him. Don was used to being winded when he played because he was in a constant state of AFib.
I didn't want to end up with a stroke, so that's what scared me the most.
He went to a cardiologist who prescribed him medication, but it wasn't a cure.
The older I get, the more medicine I would have.
A friend recommended Dr. Glenn Meininger at MedStar Union Memorial Hospital.
He said, "I think you're a perfect candidate for this hybrid maze or convergent ablation."
Hybrid ablation is the evolution of treating atrial fibrillation, and really it's intended for a specific subgroup of patients, namely those with what we call persistent atrial fibrillation.
It's a two-part surgery over 2 days with 2 surgeons.
We work alongside a cardiothoracic surgeon to work on both the outside of the heart to create what is a scar along the back wall of the heart, and then we work along the inside of the heart to create a scar on the inside of the heart. The combination of those 2 lesion sets or ablation lines are really to create a sandwich effect and create scar in the areas that drive the abnormal heart rhythm.
Dr. Brian Bethay is the cardiothoracic surgeon who does the first part of the procedure. He describes it this way.
The way I explain it to patients is I have the broad paintbrush, and then the next day the EP cardiologist goes and with very fancy mapping can simply use a very fine brush and touch everything up until the entire wall doesn't have any more atrial fibrillation signal, essentially.
The surgeons say the procedure is 80 to 90% effective at restoring normal heart rhythm.
This is something that was completely unattainable before. We had no great strategy to maintain normal rhythm in this patient population in the past.
August 24th and August 25th of 21 is when I had that operation. And then he basically told me that we expect the heart to relearn how to beat, and we should have you out of AFib in 3 to 6 months. And I was out of AFib that very next day, and the rest is history.
Now Don has more energy to play golf and play with his grandchildren. Life is good.
I use a device called Kardia and take my EKG every morning, and it's so nice to see normal sinus rhythm as opposed to AFib. So it's just truly a minor miracle, maybe a big miracle.
Mindy Becerra, WBAL TV 11 News.